morning, everyone, and welcome to our Breakfast at UMHealth 2025 webinar series. I am Dr. Kamariah Ibrahim from the Department of Biomedical Science. Will be your moderator for the first session. Today's session will be focusing on an exciting and important topic: natural product-derived compounds as promising therapies for autosomal dominant polycystic kidney disease, or ADPKD. This genetic disorder is caused by mutations in PKD1 or PKD2, which leads to abnormal cyst growth and fluid secretion in the kidneys. So it is my pleasure to introduce our distinguished speaker, Dr. Chia from the Department of Biomedical Science. Dr. Chai has been actively involved in polycystic kidney disease research, with her work focusing on uncovering disease mechanism and developing alternative therapeutic approaches, particularly through natural compounds and other novel molecules to enhance patients' outcome and quality of life. Please join me in welcoming Dr. Chia to share her insights with us. The floor is yours.
Okay, thank you, Dr. Kamariah, for the introduction. So I'm going to share my slides. Very good morning to everyone. This morning, I'm going to share with you about the nature compounds that can be used to slow down the progression of polycystic kidney disease. And I'm going to present this or deliver this in a bit more layman context in order for more people to understand this. So the overview of this presentation, first part is introduction of the PKD or polycystic kidney disease and autosomal disease, polycystic kidney disease, or we call it ADPKD. And the second part would be a review of natural products targeting ADPKD. So what is polycystic kidney disease? Okay, it is a genetic disorder caused by filled sac cysts, okay, develop and grow in the kidney. And then the cysts eventually will multiply and enlarge, and then causing kidney disease, and finally it will cause chronic kidney disease or kidney failure. Okay, so this autosomal dominant polycystic kidney disease, or we call it short form ADPKD, is one of the type of polycystic kidney, and it is the most common form of polycystic kidney disease. And the symptoms usually appear in an adult of age 30s to 50s. And it is mainly caused by mutation in PKD1 or PKD2 genes, which encodes for polycystin-1 and polycystin-2 proteins, respectively. And progression often leads to kidney failure by age of 60 in men. So the inheritance patterns of ADPKD is mainly following the autosomal dominant inheritance patterns, whereby if one of the parents is unaffected, but while the other one is affected, means either one of their chromosomes are having PKD1 mutations or having PKD2 mutations. So the babies will have 50% of affected by this disease, while the 50% of the babies will be unaffected. And the PKD1 actually localized in chromosome 16, and it contributes to 80% of the cases of ADPKD. While PKD2 is not as frequent as PKD1 mutations, it is localized in chromosome 4 and contributes to 15% of the cases. The PKD1 and PKD2 mutations will contribute to the same symptoms, but generally it is more severe in PKD1 mutation. So in PKD1 form, about 50% of patients need renal replacement therapy by age of 60. PKD2 mutations usually appear in later in life and present with a milder disease with fewer renal cysts, later onset of hypertension, and a lower risk of progressing to end-stage kidney disease. And a child, okay, and then yeah, like what I said just now, the child will have 50% of developing ADPKD if one of their parents has a faulty PKD1 and PKD2 genes. So the prevalence of ADPKD, it basically affects 30 million individuals globally, and it can affect women and men across all ethnic groups. And an estimated worldwide prevalence rate of diagnosed cases ranging from 1 in 1,000 and to 1 in 400 individuals. Around half or possibly up to 3/4 of affected individuals develop end-stage kidney disease by their 60s or 70s. And then in Malaysia, actually the prevalence is not many, it's just 1%, less than 1% of the chronic kidney disease patients. If compared to other countries like Vietnam, they have 3.5%. And Brunei and Singapore, they have also around 1.09% and 1.95% respectively. So along the course of disease, the kidney will become larger and larger. Okay, the volume of the kidney will increase, while the function of the kidney will reduce, and then the vascularization or the blood vessels, okay, will become lesser as well. So the symptoms of ADPKD generally include high blood pressure, which is the common early signs, and also enlarged abdomen due to the kidney swelling. And then the person might looks like pregnant, but actually they are not. Okay, and then they will probably have flank or back pain, blood in urea, kidney stones, urinary tract infections, progressive kidney failure. Okay, this is for if the patients are untreated, and then at the end they will develop a end-stage renal disease. So what is the diagnosis of this disease? Okay, the routine physical checkups or blood and urine tests may not always detect the condition. Usually, if the patient or the individual, they think they have family history of ADPKD, they can go for imaging with ultrasound and also CT or MRI to find out whether they actually develop the cyst or not in their kidneys. And then they can also go for genetic testing to confirm the mutations, for example, whether it is PKD1 or PKD2 mutations. Okay, the genetic testing can confirm which mutations the patient is having. And this is useful for family screening, but this testing is relatively costly. So most patients might not choose this testing if it's not necessary. Okay, treatment and the management of this disease, ADPKD. Okay, there's so far no cure yet, but treatment focus on slowing progression and managing symptoms. If the patients develop blood pressure control, so they can be prescribed with ACE inhibitors, ARBs. Okay, tolvaptan is now the only FDA-approved drugs for ADPKD or PKD. Okay, it actually is a vasopressin B2 receptor antagonist. Okay, that can control the fluid retention. Okay, and this can slow down the growth in ADPKD. And then if the patients need dialysis, okay, they will go for it, and then or if the condition is very severe, probably kidney transplant is necessary. And then for lifestyle management, okay, the patients may need to control their diet. So for example, they need to have a low salt diet, and then they need to have hydration, and to also to avoid nephrotoxic drugs. Okay, so besides the drug that we mentioned just now, okay, nowadays the natural products are gaining popularity in treating diseases. So same like in ADPKDs, some researchers are also exploring the possibility of natural products in treating or at least slowing down the progression of this ADPKD. So the potential of these natural products is to regulate the cell proliferation and also fluid secretion, because ADPKD, the mechanisms involve cell proliferation and also fluid secretion. All right, so why natural products is so popular now? Because they have several benefits. For example, this includes they have multi-targeted actions. Okay, the natural products can act on multiple signaling pathways simultaneously. So for example, say in the case of ADPKD, they can target on the if you can see like curcumin, it can target on AKT pathways and also the PI3K activation pathway at the same time. So they actually have the natural products actually have multi targeted actions, and also they may have potential for fewer side effects compared to maybe synthetic drugs like tolvaptan. Okay, because tolvaptan it is claimed to it has been found to cause thirst, polyuria, and also hepatotoxicity. Okay, so the natural product may have a better safety profiles when carefully dosed. Okay, thirdly, the natural products can be chemically diverse because they have complex structures that interact with diverse biological targets, making them promising candidates for drug discovery. And also they have better bioavailability and also metabolism. Okay, then they are well absorbed and metabolized in the body, and then this may support their use in the chronic conditions like ADPKD. And next, they have also anti-inflammatory and antioxidant properties. And lastly, they have potential to complement existing therapies. For example, they probably can complement the tolvaptan treatment, okay, in order to enhance the treatment of the disease or slow down the disease progression further. So basically, just to show you the mechanism of the ADPKD, just a very brief one. Okay, so this one is PKD PC1, which is polycystin one encoded by PKD1, and this one is polycystin 2 encoded by PKD2. So they are both transmembrane proteins that will collaborate or they will coexist together and work together in order to control the cell proliferation as well as the fluid secretion. So if either one of them is mutated or malfunction, so they will cause an increase in CAMP and subsequently increase in PI3K, AKT1, and so on. And then they will also downregulate the AMPK, and also they will increase the expression of pKa and the following downstream signaling pathways. So the natural product here, okay, are the ones that are showing here targeted on this certain pathways in order to stop the abnormal regulation of the signaling pathways, so that to improve or to slow down or to treat the ADPKD. Okay, so now the first natural product I want to introduce you is metformin. So I think metformin is not is a very familiar by you all, because it is actually a widely used type 2 diabetes. Okay, it is derived from Galega officinalis. Okay, and then it is a FDA approved diabetes drug, and then it inhibits mitochondrial complex 1 activating AMP, AMPK, and reducing ATP synthesis. It also suppresses mTOR and also cAMP signaling, okay, and then reduces the CFTR. CFTR is a cystic fibrosis transmembrane conductor regulator activity mediated fluid secretion. So with all this mechanism, okay, the metformin would be able to control or to promote the hemostasis and also slow down the cyst growth. Okay, the second natural products I want to introduce is the curcumin. Okay, curcumin is also a very common ingredient that you can find in your, maybe in your food, in supplements. Okay, it is the active compound in turmeric. Okay, targets multiple pathways known for its antioxidant and also anti-inflammatory properties. It has been studied for the potential role in managing chronic inflammation and also certain cancers and other conditions. It inhibits JAK2, STAT3 signaling, and also reduces NF-kappa B signaling, and also promotes apoptosis, okay, through STAT3 and also p53 pathways. Curcumin also can suppress PI3K, AKT, mTOR, thus delay the renal failure in PKD mouse models, though not completely preventing it. However, there's a significant challenge in using curcumin, because curcumin is poorly absorbed, and also it is poorly metabolized in the body. That's why the effect of this curcumin is not significant in the body. Okay, the curcumin can interfere with certain also can be affected or interfered by medications, but certain medications include some chemotherapy drugs. Okay, quercetin. Quercetin is a flavonoid found in fruits, okay, and also vegetables. Okay, you can also find it in a supplement form. Okay, it modulates ion channels by reducing epithelial sodium channel expression, and also increasing sodium potassium chloride co-transporter 1 activity. So in ADPKD models, it reduces cyst growth and suppresses PI3K, AKT, and MAPK pathways. And quercetin also induces apoptosis via p33 MAPK activation, making it a promising candidate for ADPKD. Okay, then the next one is steviol. Steviol also is a very common ingredient used in our daily life. Okay, it is found in the stevia plant, and it is actually a chemical backbone for steviol glycosides. okay, which is the sweet compound used as the sugar substitutes in many foods and beverages. Okay, it can reduce CFTR and also aquaporin 2 expression, and also activates AMPK, inhibits mTOR and mTOR signaling pathway in order to decreases the cyst growth and also proliferation. Okay. Next is the resveratrol. Resveratrol is a plant compound, specifically a polyphenol, okay, that acts as an antioxidant and then an anti-inflammatory agent. It is found in foods like grapes, berries, and white wine, peanuts, and then it is studied for potential benefits in reducing the risk of heart disease, cancer, and diabetes, as well as its anti-aging properties. It also acts like AMPK activator, suppresses NF-kappa B, and also inhibits SIRT1 expression that drives abnormal proliferation. So our resveratrol improves renal function and delays cyst progression in the PKD models. However, it may increase bleeding risk and also affect hormone-sensitive conditions. So caution is advised when taking supplements, especially before surgery. So there are also others natural products that have been reported so far, which is useful for ADPKD treatment, for example, cardamonin, triptolide, and which can inhibit the cell proliferation in ADPKD, and imodine and neregenin, okay, is reported to be able to inhibit both cell proliferation and also fluid secretion in ADPKD. So if you are interested in this compound, you may refer to these references. And then I want to especially introduce this natural compound, which is the focus of my research, okay, which is the tanshan. Okay, tanshan, or the Salvia meteorzera, okay, is a traditional Chinese medicine with a potential renal protective effects. So actually, besides these natural products has been reported to be useful in other kidney diseases, but it is not studied yet for ADPKD. So it can improve the renal blood flow, enhance filterability, and combat oxidative stress and iron overload induced kidney damage. And then it can be also used in a combination with other herbs, for example, huangqi, okay, to treat chronic kidney disease, and also diabetic nephropathy by reducing fibrosis. But while animal studies have shown promise, many clinical research is needed. And then individuals with bleeding disorder, low blood pressure, or those undergoing surgery should exercise caution due to the potential risk of these natural products. So in our study, we actually show that one of the compound of this tanshan, okay, which is dihydrotensionin 1, or short form DHTS, are able to inhibit the ADPKD cells proliferation compared to the normal cells. Okay, is quite significant. Okay, significant inhibition of cell proliferation, and then the cell proliferation inhibition actually due to the cell arrest at G1 phase. And then this compound also shows an increased necrosis of ADPKD, and not so much of apoptosis. Mainly is the apoptosis, the chronic necrosis of the ADPKD. And our study also shows that this tension actually can increase the immunity of actually increase the antigen presenting pathways of the cells, which probably also benefit to slow down the cyst formation of in this ADPKD disease. All right, so in conclusion, so natural derived compounds may inhibit proliferation and fluid secretion in ADPKD. And then some have been repurposed from cancer, diabetes, cardiovascular treatments, and that's why the safety of the natural products can be guaranteed. So some of these natural products promise as safer alternatives to tolvaptan. And also, however, these natural products require further validation and clinical trials in order to be used to treat ADPKD. Okay, I think that's all for my presentation. These are all the references used for the presentation preparation. So thank you very much.
Thank you, Dr. Chai. I would like to open the floor for Q&A session because we have 3 minutes more before the next session. So well, I have a question for Dr. Chai.
Yeah.
So what is your it was a very interesting research, but may I just know what's your future plan for your research?
Because my previous study, we found the inhibitory effect of tension or DHTS on the ADPKD cells, but mainly we just found the effect on the cell proliferation. But and then in the future or now we are actually trying to look at its effect on fluid secretion, because the cyst is formed by fluid, right? So we want to know whether this compound is effective in inhibiting the fluid secretion or controlling the fluid secretion, which eventually will cause the fluid retention or the cyst formations in this disease. And probably in future study also we can like include animal studies, but because now we are just doing cell line. Previously 2D cells are involved. Now we are trying to do 3D cell lines because the cysts are in 3D. So I think 3D model is more useful in order to check the effects of this compound in controlling the fluid secretion. And maybe later on we can like switch to animal.
Excellent, excellent. Any questions from the floor? I'll open this session. Dr. Chai, just one question from me. So in our current clinical setting in Malaysia, do we really check for specific ADPKD mutations in those patients?
Whenever necessary, and they want to confirm whether which mutations is involved. But I heard from the nephrologists, they actually rarely do this because it's very costly, actually very costly. Yeah.
Thank you very much. So thank you, Dr. Chai, for the insightful presentation. Very interesting presentation. Your work has shed light on how natural product-derived compounds could open new avenues in treatment of ADPKD, giving us much to reflect on in terms of both research and patient care. Thank you very much from us, from the Department of Biomedical Science. I would like to pass the next session to the next moderator.
Thank you. Thank you,
Thank
everyone,
you.
and thank you, Dr.
Thank you very
Kamariah.
much.